we're here to just have a general discussion about holds and how holds, your initial setup, is very important, because if you set it up appropriately, it is the basis for everything else that you're going to do. So without contact with the patient, you're really not able to affect any form of mechanical treatment or hands-on work. So what you need to do is consider how you set up a hold and what it will allow you to do. So the basis of a hold, or the base kind of heuristic for a hold, is what we've talked about in the past, that contact is control and control is safety. So if we're to take a patient in lateral recumbent and we're going to use the leg as a lever, now whether we're using the lower limb as a lever for the lower limb itself, some portion of it, or we're using it to attempt to work on the hip or attempt to work in the lumbar region, we have to hold the leg. Now, if I hold the leg, so the patient at this point, you can't see it on the camera, is slightly forward on the table, and we've discussed this with respect to patient positioning. So less table means I need to make the patient more stable. So when the patient's on their side, less of their body is in contact with the table. That being said, I have the patient here as an initial portion just to show something. So for me to use the leg as a lever in this situation, I'm going to have to kind of reach forward and grab the leg and do the whole setup. Now, as I pick the leg up, right, immediately what you may see is that the foot's higher than the knee, right? So we've got some internal rotation happening, and that may be hard on the patient. But you can see, as a very base deal, I've wrapped around my forearms here, so my hand is loose right now. I'm able to hold the patient's leg. Although this isn't perfect, we're setting this up on purpose to try to show something. So good contact will at least allow me to hold the leg, and I can control the leg from down here. But I'm not doing a very good job of controlling the patient, so the pelvis is rolling. Whatever I may be trying to do may not be occurring. So, because when I pick the leg up, there's immediate internal rotation, I'm going to bring the patient's leg further back on my body, right? So I'm going to bring the shin further back on my body, on my side, so that I can wrap under here. So now, if I want internal rotation, I can have it. If I don't need it, right? It's not easy necessarily to go into external rotation in this position. But now, once I have this hold, I can start to place my fixed point, place my monitoring hand where I want to. So if I want to work on some of the tissues for the quadricep, anterior to the greater trochanter, I can do that. Now, that being said, we've already talked about how I'm going to generally approach the leg as a lever from standing here to try to illustrate the concept, but we also talked about the fact that the patient's further forward. So I'm having to lean forwards to try to control the patient, to try to get a little bit more contact with my abdomen in and around the region of the patient's pelvis. So what we're going to do is kind of reset the patient so that I can do a better job, right? So I don't want to lean, I don't want to reach, because if I have to lean over the table for myself as a practitioner, that's going to begin to be hard on my hamstrings or hard on my posterior chain. So effort and load are farther away from one another. We want effort and load to be as close to one another as possible so that we don't strain ourselves. So I'm going to have you shimmy back towards me. Good. Bring your shoulders back too. Good. There you go. Good. So now I'm going to do the same thing. I'm going to take that hold with lots of contact, right? I'm going to support the knee so that I can put it where I want to. I've got better control of the lever. Now I can walk up. I don't have to lean as far. I've got some abdominal contact in and around the patient's posterior hip, right? So now, should I want to work on the hip itself, right, I can do so. I've got a good hold. This is nice and easy on me. I'm not holding the patient like this and using all my arm strength, having poor control of the lever. I've got more contact, right? So contact is control, is the base for your hold. Now I can theoretically, or my intent can be to work the acetabulum, so the acetabular joint or the coxofemoral joint, the femur and the acetabulum, right? So my hand is up here. I use the trochanter as my proxy as far as palpation is concerned. If I have a broad hold, some broad contact, I can start to feel soft tissues around the whole region, right? Now, should I want to switch my intention from the coxofemoral joint itself to some tissues that may affect it, I can move off of the trochanter and the broad contact to a specific set of tissue. So I can go anterior to the trochanter and I can start to work into the soft tissues there. Right? From this position, should I want to, I can start to work in some of the tissues posterior to it. Right? I haven't had to change my hold, I've changed my attention and my intention. My hold is still allowing me to control the lever well, move from conceptually hard tissue to soft tissue. I can move from direct to indirect. If I want to go indirect, I'm trying to make everything soft. I go through my activating forces in an algorithmic fashion, so I would go compression, distraction, torsion, and shear. Depending on what works, I would use it, whether I want to go direct or indirect. I can add in patient active. But I can only do any of that once I have an acceptable hold. So now that I've got a good hold, so I'm in and around the hip, I've been discussing working in and around the hip, I can, should I want, start to work into the lumbar column. So I've still got good hold of my lever, but now I place my hand as is needed, right? If I want to work more on the soft tissues around the iliac crest, between me and this patient, this hold works better, so a yoke hold around the iliac crest, I can start to work on it. Should I want to work in the lumbar column itself, so switch my attention and intention to moving the bones in the lumbar column, I would do this, flip my fingers down to attempt to touch some of the spinous processes so that I have a better understanding. Now I still keep a yoke, right? So I keep my thumb out so I feel a lot of the soft tissues, I get more information. So broad contact for multi-point discrimination. Once I've set my hold though, I can do all of these things. In a situation like this, should I have some reason to check into the knee, right? I can start to work in and around the knee. I move down and I can start to work in the knee. You see, contact is control. I still have lots of contact, but I can start to work through the knee, right? Then I can go back to the hip. Now this is essentially a general discussion allowing us to show that the central concept of contact is control allows for a lot of things to happen. If you utilize the concept of contact or broad contact to control the patient, to keep the patient safe, and you then immediately have the opportunity, whether it's long or short lever, to use a lot of different things. You can use either barrier, direct or indirect. You can use patient active approaches, patient passive approaches. You can use all your activating forces, your compression, distraction, torsion, and shear, once you have a good hold. Also, you want to do your best to make sure that effort and load are close together. You're not reaching too far. And that all comes back to that central concept of contact is control and control is safety. The more contact you have with something, the closer it is to you. Therefore, you can control it better. So again, we just want to reiterate the concept that setting your hold first is extremely important, extremely useful. It gives you all options. If you do not do that, if you have one intention and only one intention to work on one thing and you think this hold, whatever it may be, is the end-all be-all, you essentially shut yourself off to all options. But if you pull back and you work from that concept of contact as control, you have not necessarily infinite options, but you have a lot of options once you work from that position.